Hi, I'm Tom Doran, Chief Operating Officer at Highmark Health Plan. Welcome back to Hitting a Higher Mark. This podcast explores topics that are transforming how healthcare is delivered, used, and paid for. In our last episode, we talked about the importance of combining medical and pharmacy benefits. If you haven't heard it, go give it a listen. Today, we will be discussing the power of partnerships and how our health plan is scaling up to bring high-value care closer to home with Penn State Health. I'd like to welcome our guests, Steve Seftchick, Vice President of Network Partnerships at Highmark Health, and Dr. Safa Farzin, SVP Community Practice Division at Penn State Health. Thank you for joining us. Let's dive into today's topic. Steve, you've been working in provider partnerships since you first joined Highmark Health nearly 9 years ago, and were an integral player when we first began collaborating with Penn State Health in December of 2017. Can you tell us more about the goals of this partnership and how it helps us execute on the Living Health strategy?
Tom, going back to 2017, we were two very recognized organizations in central Pennsylvania that realized that we had an opportunity to do something really special and unique in the market there. We came together very quickly and decided that we can make a big impact by creating additional access to care in the community. So we decided to jointly invest almost $1 billion in that and creating additional sites of care. Many of which are really excitedly coming online in the very near future. And also a vision to how do we change the way that we deliver healthcare. So this was before we had our Living Health strategy, was the foundation of our Living Health strategy. How do we partner with a very capable and high quality provider like Penn State Health to deliver more access and make care more affordable? And that's really been the foundation of our goals and working together ever since then.
Thanks, Steve. Dr. Farzin, I understand you joined Penn State Health about 2 years ago, after this partnership was already in motion. What made you join Penn State Health?
Well, thanks, Tom. I appreciate being able to join you today and talk about healthcare in Central PA. I came to the region over 20 years ago now for training, and I worked in the region for over 15 years as an intensivist. And I was a witness to the strange phenomena, which is health systems began to kind of export their most needing patients to facilities outside our region, and they would go across the state or down to another state in some cases. So when I saw that Penn State Health was partnering with Highmark and really focused on building a community network with all the care being able to be delivered here locally, I jumped at it. So it's been about 2 years. It's been a great 2 years. It's been a great collaboration with Steve.
Dr. Farzin, what else did this collaboration intend to achieve?
Yeah, my focus is very much on the community. So one of the things I think that sometimes we forget is we have all the pieces of a full healthcare delivery system right here in Central PA. And so there's the academic world of Hershey Medical Center. And now, again, because of our collaboration, the 4 community hospitals that'll be surrounding the medical center. So there's a huge swath of Central PA that can now get really complete care, start to finish, with Penn State Health and Highmark.
So access to health and wellness resources are key, or one of the key goals to this partnership. How, Steve, maybe I'll throw it over to you. How are we thinking about executing on this across the community?
It's really across a number of fronts. We had the pleasure to work with Dr. Farzin even before he joined Penn State Health, when he was with Medical Group of Pennsylvania, which is really an important partnership for Highmark, since then, which is really around how do we work with the independent physicians in the community? How do we work with those community providers that are living and working in the same places that, the population lives and works? And so a lot of the partnership has really been around building out the resources and the access to care, as Dr. Farzin mentioned, the new hospitals, the new ambulatory care sites. We even put a brand new clinic on our campus in Camp Hill, a Penn State Health clinic, which has expanded access not just to our employees, but to the community at large. And really, those are the community providers, but we've also worked in clinically integrated network that Penn State Health has to expand that access through independent physicians, sharing the data that we have involving them in our kind of wellness programs, our true performance programs and the like. And then the other leg of that stool is really working with employers. We launched a new product, Choice Blue, about 2 years ago now, and we've had great success with that product in getting local employers in a product that helps to align care to high performing, high value providers like Penn State Health. And then we've been able to really work with some of those providers in a really close way. One up in Berks County, we had, a huge wellness event pre-COVID on the campus of St. Joe's. We've done, vaccination clinic events with those partners. And it's really about how do you work in tandem, payer, provider, employer, and community to deliver better health and wellness. And this has been a really good journey so far in getting to some of those outcomes.
Dr. Farzin, over the past, both you and Steve have talked about Penn State Health's facilities expansion. Can you talk a little bit about how the capital investments fit into the overall strategy, and maybe some of those recent projects a little bit more specifically?
Absolutely. So the ecosystem surrounding Hershey Medical Center has evolved greatly over the past 2 or 3 years. Penn State Health and Hershey Medical Center has always been the hub of patient care. We acquired St. Joe's Medical Center in Reading approximately 5 years ago. We acquired Holy Spirit Medical Center in Camp Hill approximately 7 months ago. The new and exciting hospitals are going to be Hamden Medical Center, which is about 5 miles from Holy Spirit Medical Center. That'll be opening in October of this year. And to follow next fall will be Lancaster Medical Center, which will be a 150-bed, fully functional community hospital that'll be opening in Lancaster.
Wow, that's a lot of activity and very busy.
That is a lot of activity, but it's very fun. It's very exciting. And the nice thing about it is, with Steve's understanding of the market and the patients in that market, as well as Penn State Health, we can really tailor those locations to exactly what the community needs. And so it's been a great process of really evaluating, investigating, learning what the needs are, and filling that need for the community.
Dr. Farzin, I think a really good example is obstetrics and gynecology and women's centers. It's one of the things that, as we started to partner, was an area of a lot of discussion. Do we have women's and babies in these new community assets, these new facilities? And we landed on the answer being yes. That's, I think, a really exciting kind of way to partner. And how do you deliver unique experiences to the community closer to where they live? And allow that great care of Penn State Health to be delivered, much closer.
I think that's a great point. And so the idea that we have these specified level neonatal intensive care units surrounding Hershey Medical Center. Hershey Medical Center has the only level 4 NICU in the region. So we have a connection beyond what I think other systems can provide of our community obstetrics to high-level academic care. It's a great model.
Well, thank you both for those comments, and it sounds exciting, to be honest. Hey, Steve, if I could ask you, we talked a little bit about the facilities and some of the capital investments. Can you spend a little bit time talking about, some of the medical education and research opportunities that are evident through this partnership?
Sure. So one of the attributes of the partnership and affiliation was we committed $25 million to Penn State Health's cancer innovation program, and those investments have really come to grow the program, increase capabilities, the access to cancer care, and allow resources to be spent on research and education in that space, which is very important for kind of the community there, for kind of our members, and really for science in general. There's also, one of the exciting parts of the partnership was the ability to take that great academic engine that exists within the Penn State College of Medicine and the faculty physicians at Penn State Hershey, and partner them with the Allegheny Health Network providers. And that's something that, we've been working on. I think one of those exciting areas of opportunity, but there's been a number of peer-reviewed journal articles that have been published jointly between the groups. We've got an innovative product that both organizations are testing around, virtual remote EKG monitoring. All that's kind of come through this research education component. We've expanded research, with both organizations. There's a grant that Penn State Health and Allegheny Health Network were part of around research or education for medical students around bringing the health system sciences curriculum to those students. So really, how do you take this living health strategy and what Dr. Farzin and I have been talking about community-based medicine, bringing all the pieces together and help build that into the medical education of future physicians. And, so that's really exciting. And I think it's one of those areas that we're going to talk a lot more about in the future.
That is exciting. Yeah, Dr. Farzin, if I could ask you, part of Highmark's mission is to reinvent the relationship between members and their clinicians. Can you just talk a little bit about how Highmark and Penn State Health have been working together to execute on this important item?
I think that's a great item, and we've made a commitment to make sure that every member of our community is connected to Penn State Health in a very close way. So we call it the 10-20-30 plan. So we've committed that every member is connected to a primary care office within 10 minutes. They have access to a subspecialty office within 20 minutes and an acute care hospital within 30 minutes. So no matter where you are in central Pennsylvania, essentially, you're connected to Penn State Health in those ways. And I think that it's worked very well to let the local people in the community understand how close Penn State Health is and how they can get all their services in one shot.
Steve, what are the benefits of this partnership for patients and members?
So I think one of the things that members and employers and our customers and our shared customers really get as a benefit of this is how we're working together as a payer and a provider. And that really comes in kind of all levels of that care continuum. We have a program around intensive care management for folks that are in the hospital with very severe conditions that our teams partner up very closely at the very beginning of that care, our integrated care teams. And that's, that has a unique benefit for people that are experiencing a shock kind of in their healthcare journey, to start them out in a collaborative way, working with payer and provider kind of together through that journey. The other part, which really is foundational to a lot of the work that we've done with the community physicians, with the independent physicians, is around our True Performance program for primary care, in where we're sharing data, gaps in care, opportunities for kind of missing preventative care, to really help improve the health and wellness of patients. And we do that by doing that work together in partnership. And I think that's, to me, what really fuels me and gives me passion in this partnership work is we're not just, creating interesting slides or beautiful products, but we're actually working together to change how care gets delivered. And that's really done by giving providers more information, trying to work to make things easier, and giving, our members what they need when they need it. So
I'll just add, Tom, first, Steve and his team, they do make beautiful slides. I've seen them, they exist. But that part about value-based care and working with the independent physicians, I've witnessed some of that. I think it's a very big deal. So I'm confident patient comes into our system. It's one thing for a physician to request or recommend cancer screening. It's another when the payer and the health system are then following up with that patient to say, hey, listen, you're overdue for the screening. Can we help make it easy for you? Or, you have diabetes and you have a number of metrics that maybe need some help. Let's talk through that. And are there any social determinants that may help us get there? So there's so many levels of collaboration that it feels very unique. And I've witnessed that change in our physician practices all the way to the patient.
Very, very cool. My final question for both of you is, where do you see the strategic partnership going next? And Steve, why don't I begin with you?
I am really just excited for Hampton to open. I think, it's going to be a real gem for that community around, Harrisburg. And, I think that's the first inkling of this is how the experience is different in the community. This is the access to care that people are going to get and the high level of care and quality that people are going to receive out of that. I think from there, it's really limitless. We said this is a big deal when we did this arrangement, when we came together. And I think we spent the last 3 years really building some of the infrastructure and those capabilities. And I think what to expect next is only more and a greater value for our customers and patients.
Dr. Farzin?
Yeah, Tom, we talk a lot about culture at Penn State Health, and I know it's the same for Highmark. And we have pillars of culture, which are respect, integrity, teamwork, and excellence. I look forward to that spreading throughout the community as we open Hampton Medical Center and Lancaster Medical Center. I also think that this connectivity to the resources that the community has by virtue of our pediatric hospital and Hershey Medical Center, again, I think the community at large doesn't really know that exists, and it's our job to connect them, to make it seamless, and to make sure they're getting those resources in the community when they can get them in the community, but then also quick access to the academic center when they need it. So I think working on those connections, it's always expanding. The connections are always increasing. I think it'll be great for the community.
Well, I'd like to thank you both, Steve and Dr. Farzin, for joining me to talk about the strategic partnership